Oh. Ah! All right, friends. Yes, I do need to take my Christmas down, but I wanted to record this. It's gonna be crooked. I wanted to record this ad before I did because it's no fun taking decorations down. My friends who gave me these glasses, if you follow me on Instagram, you see me wear them. I often don't wear them in videos because this happens. But these are, anyway, this is not what this is about. These are from TIJN, which I recently learned through an email chain on accident that is allegedly pronounced TIJN, like TIJN. Anyway, this company, I've worked with them for a little while. They sent me these glasses, some sunglasses, and recently have come out with things like shoes and bags and jewelry. And so I got some fun pieces from them that I wanted to share with you. I pulled one of them out and somehow have misplaced it. So I'll include a picture of it. But I got a few pieces from them, including this necklace, which is super cute. I don't have a ton of jewelry, so this has been like a fun piece to wear. I'm chewing gum right now, I'm so sorry. I also got this pair of shoes, these little green shoes. They're kind of vintage looking, but they're really fun. Everybody needs a pair of green shoes in their life. If you follow me on Instagram, you've seen this, you've seen a picture of these things like months ago, but I'm finally telling you about it because I'm finally posting a video. So I would encourage you to check their stuff out. They're coming out with new things all the time. Right now they have some new jewelry out, some like handbags. I love their glasses. I love their glasses. So if I get new glasses, I'll probably definitely be getting them from there. So I would encourage you to check them out. I hope you enjoy this video. I don't know if I have a discount code, but if I do, it'll be in the description. And the website is in the description as well. Enjoy the video. I really have not prepared for this, which is just par for the course, it feels like. But hello, friends. It has been months since I posted a video for you. It is currently Christmas break, so I'm gonna hopefully record some videos now so that you have some throughout the year. Things have been so crazy in med school. Last time I talked to you, I just finished my surgery rotation. At this current date, I just finished my medicine rotation, which was 8 weeks of medicine, and took my shelf exam, and then yesterday was Christmas. So lots of things have changed since then. So in this video, I just wanted to talk about what I did during my medicine clerkship and sort of how I studied for my shelf exam. And then in a separate video, I'll talk about sort of tips and tricks on how to be a successful clerkship student. I will say that I have a little bit of a lisp right now. I'm using clear aligners to straighten my teeth. I just didn't like the bottom teeth. They're a little bit straighter, so that's cool. Did I need to spend that much money straightening my teeth? Probably not, but I'm doing it anyway. So if my voice sounds a little bit different, that is why. So let's crack into it. My medicine clerkship was 8 weeks long. So we did 4 2-week rotations. My first one was my subspecialty, which was pulmonology. So this is inpatient pulmonology. We saw all kinds of patients. I personally did not work in the ICU, so I didn't see a whole lot of COVID focused care. I did see a lot of post-COVID things, like one of my patients primarily was post-COVID fibrosis of the lungs with some kidney involvement. I also had a lot of interstitial fibrosis or interstitial lung diseases, sort of like the classic pictures, but then we also saw a lot of rare things, a lot of cystic fibrosis, those sorts of things on pulmonology. I learned a lot. I will say that when you are doing a subspecialty, especially inpatient, it's very likely that you will still be managing multiple different problems. So if you have the opportunity to choose a specialty inpatient that you're going to be following, sort of an inpatient rounds, don't be discouraged or think that you're not going to see any renal if you're on pulmonology, or that you'll never see any pulmonology while you're on renal or any cardiology. You sort of manage everything, even if you are a subspecialty team. That being said, I also did 4 weeks of general medicine. I did 2 weeks at the VA, 2 weeks at the main hospital. And so at the VA, everything is a little bit different there just because their system is different. They don't use the same health record that we did. So I had to relearn, or I guess learn new, this system to take care of patients and check charts and stuff, which was a whole nother thing on top of just like, I don't really know how the normal thing works very well. And I certainly did not know how to check charts very well at the VA. I learned a lot of things about medicine, and one of them being that sometimes you really are just the person being like, this thing needs to be done, but I don't do it. and waiting for the people who do it to do it, and hearing a lot of times like, no, we're not going to do that, and then waiting a week and then they change their mind. So I didn't love that. I was not like a huge fan. There were some like sort of not emergent, but maybe urgent things that should have been taken care of within the first couple of days of a hospitalization that ended up happening like a week later, which was just frustrating and costs a lot of money, I'm sure, to the health system. And then I did 2 weeks of inpatient medicine, general medicine at the main hospital. And I think what's really cool about being at a teaching hospital, about being one of the larger hospitals in the state of Tennessee, is that we get to see a lot of like weird things, more rare things. So I did see a lot of sort of like textbook things that I'm like, wow, I didn't even think that was a real thing, which is cool. So if you are in your pre-clerkship, like if you're still in your preclinical years, if you're still doing like only classroom, some of those things that you're like, I'll never, ever, ever see this, you might. And once you do see it, it like is cooler and more fun to learn. For example, hyponatremia, I did see a case of that from SIADH related to a pulmonary infection. That's kind of cool. If you didn't think that could happen, it really can. And we had to do the whole calculation on how to titrate them back up to the normal sodium and not cause demyelination. Know those things when you're going into medicine, I guess. And then for our last 2 weeks, we do outpatient medicine. So we rotate through clinics. We had a new attending like every 4 hours. So we had 2 attendings a day. I didn't love that system just because you don't know who you're working with. They don't know you. They don't know what you're capable of. Also, you have to guess that you're going to chart check on the patients. And so I would be like prepared for patients, and then I wouldn't see any of them alone in one clinic. And then I would see all of them alone in the other clinic. So it was just kind of a mess. But I did hematology clinic, electrophysiology, endocrinology, GI IBD, GI celiac, and I think that's it. I think those are all the clinics I did. I did a couple of them twice, some only once. And then I took my medicine shelf exam on the Friday, the end day, which is about I think it's 2 hours and 45 minutes long. I would say the way, oh my goodness, that's big. I've got a lot of secrets in my hair. The way that I studied for my shelf exam, I did all of the Uworld questions for medicine. My study strategy for that was not super strict. I think I did the calculation where you needed to do like 170 a week to keep up and get done like a little bit before the exam. And there are some weeks that I did a little bit more than that and some weeks where I did less than that. And I was able to get quite a few done in the last couple of weeks, especially on outpatient, because we would get done at a reasonable time. Normally on clerkship, there were some days where I had to be there at 6 a.m. There are some days I had to be there at 7 a.m., but inpatient, it was usually around the 6 or 7 range. And then sometimes a little bit earlier than that, like 5:30. It was a little bit like not quite as early as surgery, but like 6 or 7 a.m. I'd be at the hospital chart checking and pre-rounding on patients. Rounds lasted like 2 to 4 hours depending on your attending, and presentations, I like did presentations on rounds and helped make plans, but usually they weren't correct, which is like kind of the way it goes. And then I would get done anywhere in inpatient. Sometimes I would get done like really early, like 2 or 3 o'clock, and sometimes I would get done really late, like probably 6 would be like really late for medicine, whereas for surgery you could be there forever. So on outpatient though, we got done usually, sometimes we had half days and sometimes we would get done at like 4 or 5. So we did get done earlier and had more time to study and didn't have to be at the clinics quite as early as like 6 or 7 a.m. Sometimes my clinics didn't start till 10 a.m., which is amazing. So I got a lot more studying done then. All that to say, I finished all the medicine Uworld questions. There were about 1,200, I think. And I went through some of the ones that I got wrong, probably like 80 of the ones that I got wrong. I got more than that wrong, just for the record, but I didn't have time to go through all of them. I also read some of Step Up to Medicine, which wasn't super compatible with the way that I learn. It really does feel like just like a list of symptoms and stuff. But if you do see it or you have a patient who has a disease, it's good to review that in there. I also, the last couple of days, was like flipping through first aid and just seeing like what mnemonic devices they had for things, because I didn't think that the Step Up to Medicine book had a lot of ways to remember stuff. So if you weren't like really with it that day, like reading a textbook after work just wasn't gonna stick anyway. I did fine on my shelf. We got our exams back just a few days ago. We operate on a pass-fail system, so I am not gonna share my percent with you, but I did pass, and I'm not sure what the pass-fail cutoff is if it like varies by institution, but that's all that matters. P equals MD. Same with my surgery shelf. I don't think I announced it, but I ended up passing that as well. So I'm on the right track. Coming up for me is pediatrics, and I will start with my anesthesia elective. So I'll do 2 weeks of anesthesia. Things to know. This is sort of a disorganized video because I'm just speaking. I really have not prepared for this, which is just par for the course, it feels like. But things to prepare for as far as like being successful on the shelf exam, I would say big things are know your antibiotics. I would say know, like, this is also helpful for being on the wards, but like have a favorite for gram-negative, for gram-positive, for anaerobes, a favorite for Pseudomonas, and sort of like kind of know different categories as far as that is concerned. Have a favorite for MRSA as well. Other things would be, I feel like it was very heavy on decision making and what comes next. So more so than like understanding the pathophys of a disease, the shelf exam is more focused on, okay, what are you going to do about it? And I think what would have been really helpful, or what was helpful for some diseases, I knew them for some and not for others, is like the protocol. What do you do next? What's the appropriate imaging study if this is what you think is happening? What's the Wells score? And so then what do you do? What's the CHA2DS2-VASc score? And so if you know what the score is, what medication are you going to give? Do they need anticoagulation? Those things like come up, I feel like, quite a bit. NBME cannot sue me because these are things that like everybody needs to know, and I don't remember any specific questions, but I feel like knowing protocols came up quite a bit. I would also say that you unfortunately will always need to know sensitivity and specificity and what that means. I feel like for me, it was acceptable to review this a couple of days before the exam, just like the equations, and go through a couple practice problems. I think the ones on Uworld were helpful and fine and similar enough to what I saw on my actual exam that it wasn't a big deal. I also found the Emma Holiday reviews to be helpful in like knowing what to study. I always made the mistake, I guess always, with the medicine shelf and the surgery shelf, watch the Emma Holiday reviews like the day before. I'd recommend maybe doing this like a week or two before your exam to see what things you need to brush up on. I can't remember, and I just took this exam, I can't remember if everything she said was helpful or if some things she said were helpful. I think there was like a question or two that I got right only because I watched that review. However, I think that having like a week or two to review the big concepts that you're like, oh, actually I forgot about that, or I could brush up on that, that would be helpful. So if you do watch those reviews, I'd recommend. I know a lot of people at my institution watch Sketchy for pharmacology and for different bugs. Lots of people use Anki. I didn't use any Anki just because there's just too much to do. I did all the Uworld, which was hard enough, I feel like, and read quite a bit. That was enough for me, but I mean, obviously I could have done better. Everyone could always do better. So if you have time, like adding in other study strategies would be helpful, but that's what I did, and I passed. What else? I feel like that's sufficient. If you have Uworld, I'd recommend doing it. Read the book if you can. I didn't read all of it, so I can't say that was like the thing that brought me over the edge. If you are going to do Uworld, I would say I just did the study version of it. I didn't ever do time tests on there, which I could have and maybe should have, but I feel like there was just so much to study that I was never going to review that many questions if I just didn't do it right away. So keep that in mind when you're doing it. I know some people who did do the time version, but as far as I was concerned, I just did the study mode, never the timed mode. I think that's it. I think that's like a pretty good overview of what I did on my medicine rotation and how I studied for my shelf exam. My hair is like kind of nice and kind of a huge mess right now. I am going to cut this video off and I will talk to you in the next video. The next video, I believe, hopefully, if I can pull my life together, will be about how to be a successful clerkship student on medicine and sort of how to like advance clinically as far as I'm concerned at my level. Okay, I'll talk to you all later. Goodbye. Merry Christmas.